Hi everyone! We're the Tripler Clinical Group this semester, and today we're excited to present our PBL project, Improving Mood Through Physical Moves. Our project focuses on implementing simple, accessible movement based interventions on our inpatient psychiatric unit to support mood enhancement and overall well being.
Our needs assessment, we spoke with patients, nurses, mental health technicians, case managers, and physicians. Everyone agreed that the unit needs more structured therapeutic activities. Patients often told us they feel bored, restless, and anxious throughout the day, and staff confirmed that there are currently no scheduled physical activities, only an open space that patients can use on their own. Because many patients struggle with depression, PTSD, low motivation, and poor sleep, most stakeholders felt that guided physical activity would be one of the most helpful and realistic interventions. It is safe, low cost, and easy to run on a secured unit, which makes it more of a feasible option than options like pet therapy and art therapy. The evidence also supports this. Physical activity has been shown to reduce anxiety, depression by regulating the stress response and increasing mood boosting chemicals. Research also shows benefits for patients with schizophrenia, including improvement in negative symptoms and social functioning. Exercise can reduce cravings in patients with alcohol use disorders and improve sleep quality for people with mental health illnesses. Yoga based activities also helps with relaxation and emotional regulation, which is important for many military patients. Overall, both the feedback from stakeholders and the research supports implementing a structured physical activity group as a meaningful way to improve patients' well being on the unit.
Prior to implementing our project, we gave the patients a survey which had 8 questions ranging from 1 strongly disagree to 5 strongly agree. These questions assess how patients felt about exercise, whether they believe physical activity could improve their mood, reduce stress or anxiety, and help manage their mental health symptoms. We also asked about their motivation, their physical ability to participate, and their willingness to join a short group workout. On the right side, you see the bar graph summarizing the responses. Each question shows varying levels of agreement, but overall we can see that most patients lean toward believing exercise has a positive effect on their mental health and would be open to participating in group activity. These baseline results help us understand where patients started and highlight the need for structured physical activity on the unit.
Based on the needs we identified on the unit, we decided to implement a short, structured workout routine to help patients incorporate simple physical movements into their day. This routine is designed to be safe, low intensity, and easy to follow. We started the routine with light stretches, then progressed to body weight exercises including squats, lunges, squat to lunge transitions, jumping jacks, push ups, and a 1 minute plank. We wrapped up the session with final stretches to cool down.
Here we have the results for our post-exercise survey, which patients completed after participating in the short workout. The survey asked the same 8 questions but focused on how the workout impacted their mood, stress levels, motivation, physical comfort, and overall understanding of how physical activity supports mental health. On the right side, the bar graph shows that most responses shifted toward the higher end of the scale, particularly areas in improved mood, reduced stress or anxiety, and feeling that the exercise were appropriate for their abilities. We also saw strong agreement in questions about wanting physical activity sessions to continue on the unit, which highlights patients' interests and engagement.
After implementing our PT with the patients, we asked the staff for their input. They told us that our exercises were good choices. Since they are all active duty members, they're used to doing a lot of push-ups, so they mentioned that that was a good addition to our workout routine. They also mentioned that it was very engaging. We decided to let each participant choose their own song to play throughout the workout, and staff mentioned how that was a nice addition for them. However, as aforementioned, all of them are active duty members and they're used to vigorous activity, so the staff brought up that our routine may have been too easy for some of them.
In summary, our project showed that adding brief physical activity sessions meaningfully improved patients' mood, motivation, and anxiety. Although many patients initially felt unsure and motivated about exercise, post-survey results showed clear benefits and a better understanding of how movement supports mental health. Patients found the sessions engaging and said they would like to continue them. Overall, our findings show that simple, structured movement can be an effective, accessible way to enhance wellness and support psychiatric care. Thank you for listening.